everybody, so thank you for joining me today, and in today's video we're going to be looking at how to be successful during the clinical years at medical school. So I'll be signposting you to some of the resources that I used when I was studying for my exams, and I'll be discussing which resources I found most useful. So without much further ado, so I've made quite a few videos now, so if you have a look at my playlist on the medicine guide, I've made similar videos such as how to be successful during the pre-clinical years at medical school, how to get the most out of hospital placements, how to get the most out of GP placements, and how to succeed in your clinical OSCEs. Okay? So in today's video, like I said, we're going to be focusing on what sort of resources you can use throughout the medical course to help you get the best marks and help you to get the best understanding of each rotation. So I'll be covering resources for medicine and surgery, resources for obs and gynae and pediatrics, geriatrics and psychiatry. Okay, so let's start off with medicine, and we're going to start off with cardiology. So these are the three books that I found were most helpful in terms of helping me to get a better understanding of cardiology. So the ECG Made Easy is a really nice, small, simple book that you can use to help you understand how to interpret an ECG, and they do have examples for you to work through, and later on they've got a small little quiz section. So the ECG Made Easy, I think it's the bread and butter of understanding ECGs. It's really, really good. Now, Medicine in a Minute has a chapter for all the different medicine components. So there'll be a chapter for cardiology, a chapter for respiratory, hematology, gastro, hepatology, renal, endocrine. It's a really nice book which summarises all the different aspects of medicine, and in particular I thought the cardiology section for Medicine in a Minute was very, very good. And also I've recommended Crash Course Cardiology. So this Crash Course book is very, very good, and at the back of all of the Crash Course books they have a chapter with practice SBAs and EMQs for you to work through. One thing to bear in mind is that all of these books will be available at the campus library, so you don't have to worry about going out and spending any money on these books. All of these books will be available on the campus library, so don't worry about having to rush to the shops and buy any books. Okay, so for respiratory or pulmonology, similarly again, Crash Course Respiratory Medicine was very, very good. I thought the lecture notes of respiratory medicine, so that's the book in the middle with a black cover and this blue little strip going through the middle. So lecture notes for respiratory medicine I thought were very, very good. And then finally there's also the Oxford Handbook of Respiratory Medicine, which helps to give you a good concise overview of all the different respiratory diseases. Okay, so we're still with medicine, but this time we're focusing on neurology and neurosurgery. So these two components often interlink and do intertwine, so that's why I've got them together in the same region. So these are the books that I used for neurology and neurosurgery. So firstly we've got Neuroanatomy and Illustrated Coloured Text. So this just helps to summarise the key aspects of neuroanatomy, because understanding neuroanatomy is really important in helping you understand neurology and neurosurgery. So I would suggest that book just to help you freshen up on your neuroanatomy. And then in the middle you've got Neurosurgery and Neurology Illustrated. So that is a very good book in terms of helping you understand the detail that you need. And finally, Crash Course Neurology, I thought it's very nice. It covers all of the conditions that you need to know as a medical student, and as the same with all of the Crash Course books, they've got a chapter right at the end with practice SBAs and EMQs, which I found invaluable. So gastroenterology and hepatology, again similar to neurology and neurosurgery, gastroenterology and hepatology do intertwine and do interlink, so that's why I've grouped them in the same corner. So gastrointestinal system by Crash Course was very, very good, and also Gastroenterology and Hepatology by Lecture Notes is another book that I found was really helpful. So carrying on with medicine, so looking at hematology now. So I thought the crash course hematology and immunology books were very, very good, and similarly the hematology and illustrated colour text just helps to give a nice overview of all of the different hematological diseases, but it also goes that one step further and it helps to describe the normal process involved. So in this book it will also have diagrams explaining the clotting process, and whilst that may seem a little bit silly, when you get to the clinical years you do often forget sometimes the basic underlying biochem physiology, so that's why I thought the illustrated colour text is quite nice, because it does describe the pathology and it also helps to give an overview of some of the biochemistry which you might have forgotten about. So endocrinology, I thought the crash course book for endocrinology was fantastic, and that's the only book that I really used to help me understand endocrinology. Rheumatology and orthopedics, again they do interlink and they do intertwine, so I've recommended similar resources. So there's a rheumatology and orthopedics book by Crash Course, and that's a combined book, and it's quite a detailed book, but I think the level of detail that it has in that book is satisfactory for a medical student, and it's more than enough for your needs. And then on the right hand side to that there's Rheumatology, a clinical handbook. Now this is just focused on rheumatology and it is slightly more detailed than the crash course, and the difference is that with the clinical handbook it focuses just on a select few rheumatological conditions, but like I said it's very, very detailed, and I like the way that the book is structured, so it will have examples of signs, symptoms, investigations, management, and it will also have a worked case example for you to look at. So it's a really good book. If you can find it on the library shelves I would highly recommend it. And then for dermatology, this is what, honestly, hand on my heart, this is what I used. Dermatology, a handbook for medical students and junior doctors. So this handbook is something that you can download for free off the British Association of Dermatology website. So you can download it free from their website. All you have to do is to type into Google BAD or the British Association of Dermatology and write down dermatology for medical students or dermatology for junior doctors, and this will come up as an online PDF which you can download directly from their website, and it's really good because it has all of the different conditions that would be expected of a medical student. So it's got pictures of the different skin conditions, and it's got a chapter explaining the signs and symptoms, the investigations needed, and the management for each of the different skin conditions. So I think that's the best way of revising dermatology, and it's for free, which is also a bonus. Okay, and for surgery, so Teach Me Surgery is a very, very good website for surgery. So if you have a look at that online, it's got all the different aspects of surgery divided into different chapters. So it will have a chapter on ENT, a chapter on vascular surgery, a chapter on general surgery, chapter on orthopedics as well. So it's a really good website to use, and it's summarised all the key information that you need. So looking at general surgery now. So I thought the crash course surgery book and the general surgery lecture notes were very good at explaining the detail that's needed, because although Teach Me Surgery is very good, like I said, it summarises the key points of information that you need, sometimes it does lack in the detail, so that's why I use the crash course surgery book and the general surgery lecture notes to help me get a better understanding. So urology and renal. So renal is the little picture of the kidneys that I've got at the bottom here. So urology and renal often do intertwine. So that's why I've grouped them together. And these are the two books that I have recommended. So the crash course renal and urinary system is very good because it covers both renal and urology. And the lecture notes for urology I thought was fantastic. Because it really helped to explain the depth of knowledge that I needed for urology, because urology was something that I covered only in my final year. It wasn't something that we covered at all in the previous years, so I thought the lecture notes was very good at giving the detailed information, but it explained it in a very simple way. And ophthalmology, and at the bottom I've got what I've tried to represent is ENT medicine really, and so for that, the ENT and ophthalmology, I used the crash course book. I thought that was the best one that I could find. I didn't think any of the other books that I looked at in the library were particularly useful, except for this book for ENT and ophthalmology. So now looking at obs and gynae. So the Teach Me Obs and Gynae website is really good for obs and gynae. So if you go online to Google and try Teach Me Obs and Gynae onto the website, onto Google, it will give you the link. And they also have an app now, I believe, for Teach Me Obs and Gynae. So that's a free app, and that's also something that you can use. Also, the Obstetrics and Gynecology by Impey and Child is essentially the bread and butter of obs and gynae. I think it's the #1 book that any obstetrician or gynecologist would recommend. So, and I think rightly so, because it was a very good book. And also Crash Course Obs and Gynae is very good, and it has a chapter right at the end with practice SBAs and EMQs. And for pediatrics, now this may sound a little bit controversial, but these are the 3 books that I found helpful for pediatrics. I know there's a sunflower book, but personally I didn't really find the sunflower book very easy to read. It's quite good in the fact that it covers a huge range of pediatric conditions. However, for me, I found it was too detailed, and it could have, and the information could have been summarised in a better manner. I thought that these books were better in terms of giving greater clarity, so it's far more easier to understand the information, and it was more concise. So that's why I've recommended Crash Course Pediatrics, and also Pediatrics, the Clinical Handbook. So that will have fewer conditions. So the Pediatrics, the Clinical Handbook will have fewer conditions than the Crash Course book. However, in the Pediatrics, the Clinical Handbook, it's quite detailed, and also there are examples of cases that you can use to help you really understand the topic. And finally, Pediatrics at a Glance. So this is quite a small book, it's quite a thin book, but it does summarise information quite concisely. It's got diagrams to help illustrate the different signs and symptoms that a young child might suffer from. So I thought it was really nice in terms of understanding exactly what's going on with a particular disease, and then to understand the detail, then that's when I would use Pediatrics, the Clinical Handbook, and Crash Course Pediatrics. So looking at geriatrics and psychiatry now. So for geriatrics, I use Geriatric Medicine at a Glance. So this helps to summarise information quite concisely, and the detail of geriatrics is something that I found and enjoyed in elderly care medicine lecture notes. And psychiatry. So for psychiatry, the bread and butter of psychiatry is the ICD-10, so that's in the middle. So you can download this as an online PDF straight from Google, and copies will also be found in the library, but it's up to you if you want to get a hard copy from the library, or you can just download it online for free as a PDF. And I thought a clinical handbook psychiatry was really good, and it's also got examples of how to approach any psychiatric OSCE stations. So that's a little nice extra piece within the clinical handbook. And then finally, psychiatry lecture notes is really good at describing and giving examples of all the different delusions and all the different styles of thinking. So understanding that the terminology surrounding psychiatry, I thought, was better explained in the lecture notes series. Okay, so these are references, but what I want to leave you with this message today is this. Sophia has two meanings: forget everything and run, or face everything and rise. The choice is yours. So medicine is quite a challenging course, but hopefully after using the books and the websites that I've recommended today, it will help you with your learning and your studying and put you in a better position when you're approaching your final exams and in the future when you're approaching patients. So if you like the video that I've made today, if you've enjoyed my previous videos, please give me a thumbs up, please subscribe to my YouTube channel, and please share with your friends. Also, post in the comment section below if you think there's anything that I've missed out, or if you think that there's actually a better book out there which I may have not come across. So thank you for watching my video today, and I wish you the best of luck.